AI is not new. AI has been around for decades, really. But what's different these days, really, is the fact that we have an NHS which is stretched in terms of resource, really. And AI can actually improve the effectiveness of the NHS in coping in an environment where there's not enough people to actually do the work that's required. AI can automate a lot of tasks that would typically be done by clinicians and caregivers and so on, and they do that very, very effectively. And I think one of the big differences nowadays as well is that people are beginning to release data and make data available about patients and so on. And we see that happening a lot with the FHIR programs, for example, in England. And that's going to make a lot of data available. And that will increase the power of AI in the sense that we'll be able to apply artificial intelligence in order to mine that data and be able to deliver health to populations. FHIR is a messaging stand and also a clinical data model as well, really. And I think a lot of the power that it will give to the NHS is the fact that the F in FHIR stands for fast. People will be able to deliver solutions quicker than we wouldn't be able to do with other standards and other technologies. One of the attributes of FHIR is that it gives you the ability to retrieve a discrete bit of data regarding a patient. So instead of getting somebody's complete patient record, I can just look at somebody's medication or somebody's lab results and so on. And what does that mean? That means basically they can start to deliver that type of content on mobile devices, for example. So I think it's going to be very, very exciting because a lot of these systems are being made FHIR enabled. So everything's going to hang together very neatly and things hopefully will happen much quicker than they would have done otherwise.